Hello, my name is Jason Arnold, and this is the second video blog, excuse me, for Health Informatics Course 645, which is Risk Assessment and Ethics. Today we're going to discuss a scenario where we are a patient having a non-invasive procedure at an academic medical center, and at this academic medical center, the attending physician informs me, the patient, that it's regular practice for the fellows or residents at that facility to perform the non-invasive procedures while the attending physician simply instructs. The actual procedure that I wanted to discuss or use as an example would be transcranial magnetic stimulation, or TMS. And that actual process is used to treat individuals suffering from depression. Basically, it's a non-invasive procedure that's going to utilize magnetic fields to stimulate, specific nerve cells in the brain, again, to treat symptoms of depression. And it's typically utilized in treatment of individuals with depression where other areas of treatment have not been successful, mainly like psychoanalysis or medication. Specifically during a TMS session that usually lasts about 40 minutes, there's coils placed around the brain, and those electronic or electromagnetic pulses are delivered to the areas of the brain that are going to affect mood control and depression. And again, it's usually able to decrease activity of individuals with depression. Now, there are risks associated with it, mainly if you have a history of seizures or things of that nature. You definitely want to inform your doctor. Persistent headaches and tingling of the spine definitely can occur, but it definitely is a better procedure other than like vagus nerve stimulation or even deep brain stimulation, where you either have to have anesthesia administered or have specific nodes placed in the brain or in the areas of the brain to deliver the impulses. It's definitely non-invasive, and it's something that a lot of more people in the psych department are utilizing. Speaking of the psych department, the reason I chose that actual non-invasive procedure is because I actually do work at a psych hospital, and we utilize a lot of fellows at our facility, and they're quite knowledgeable, and they're useful and helpful in treating the individuals at the hospital. So from that example of my history of understanding how the fellows work and how thorough they are and how studious they are, if I was at a academic medical center having a procedure like TMS done, I would definitely feel comfortable with a fellow performing that procedure. I would know, again, they would be knowledgeable of it, and they would be able to consult me or help me understand the procedure, and definitely make me feel comfortable before the procedure took place. So again, as far as I'm concerned, I would definitely be comfortable with a fellow performing a procedure of that sort. However, and it's a big however, I know I didn't answer the question, but if I could just touch on the actual second part, the legality part of if that was not the case, and if I was not comfortable because it's just so obnoxious, it would definitely be an issue. And if something were to happen during the actual procedure, let's say I had a seizure, or I blacked out, or I had burns or things of that because of the procedure, because it wasn't properly done, or it was a person that wasn't understanding of the procedures, that definitely could be a medical professional liability. But the reason that is concerning, because the example that it says, if we're not comfortable, and the actual attending physician said that whether my feelings are validated or not, the procedure will be done, and he kind of mandated and gave me a directive, that's an issue of general consent. And if I'm not giving general consent, I know it's not written consent because it's not invasive, but if I'm not giving general consent for a non-invasive procedure, and it's still stated that I must go through that procedure, A, that it would not get done, but B, again, it's so obnoxious for a doctor to have that much arrogance to try to give a directive and make somebody do a procedure, or tell somebody that regardless of my feelings that the procedure will be done. So that area of general consent would definitely kind of negate any procedure that I would be having at that facility. So as far as the legal aspect, that's what I think of that. So again, my name is Jason Arnold. That is my video blog. Hopefully I didn't talk too fast or it wasn't too quick. Please give me any feedback, any questions, comments, criticisms, or replies. And again, I do thank you for your time and can't wait to hear all the replies and responses from the rest of my class. Thank you so much, and y'all have a blessed night. Peace.